Interpreting an ABG often feels like hitting a concrete wall, cold, hard, and confusing. But I think there's one main reason for that. We always start in the middle of the story. It's like dropping someone in the middle of a forest and telling them, now, find your way home. We're thrown into a mess of numbers and abbreviation like HCO3 or PaO₂ and accepted to just get it. But memorizing a salad of terms without understanding what they mean at a basic level, that's not knowledge. True understanding begins when we ask, what's the story behind each of these values? That's exactly what we're going to uncover, step by step. Let's begin with the basics. The heart is a vital organ located in the mediastinum. It pumps blood to the body tissues. Blood enters the right side of the heart through the veins and is then pumped to the lungs. In the lungs, tiny units called alveoli exchange gases. They deliver oxygen to red blood cells and remove carbon dioxide from them. After collecting oxygen, red blood cells travel back to the left side of the heart and distribute that oxygen to the body tissues. This cycle continues for the entire lifespan of a red blood cells, about 120 days. Before we go further, let's learn a few key terms. FiO₂, fraction of inspired oxygen. The air we breathe is made of different gases. 78% nitrogen, 21% oxygen, and the rest are trace gases. So, with every breath, we inhale about 21% oxygen. That's our FiO₂ under normal conditions. This percentage stays constant, whether you're at sea level or on top of Mount Everest. Barometric pressure. You might wonder, air has pressure? Well, yes. At sea level, scientists filled the container with mercury and inserted a thin tube. They found that the mercury rose 760 millimeters, meaning atmospheric pressure is 760 millimeters of mercury. But not all of that is dry gas. About 47 millimeters of mercury is water vapor. So, the dry gas pressure is 713 millimeters of mercury. As you go higher, air pressure drops because there's less air above you pressing down. PaO₂, alveolar oxygen pressure. Since 21% of the air is oxygen and dry gas pressure is 713 millimeters of mercury, we'd expect the oxygen pressure to be about 150 millimeters of mercury. But in reality, alveolar oxygen pressure is only about 105 millimeters of mercury. Why? Remember, alveoli give oxygen and receive carbon dioxide. When we exhale CO2, some oxygen escapes too. That caused the pressure to drop slightly. So, PaO₂ equals 105 millimeters of mercury under normal conditions. Here's a simple version of the formula we use to calculate alveolar oxygen pressure. PaO₂ equals FiO₂ times barometric pressure minus 1.2 PaCO₂. In more advanced versions, we include something called the RQ, but don't worry about that for now. Arterial oxygen pressure, PaO₂. Oxygen exists in two forms in the blood: dissolved in plasma, bound to hemoglobin inside the red blood cells. PaO₂, arterial PaO₂, refers to the dissolved oxygen in plasma. This is the oxygen that moved from the alveoli into the capillaries. Normally, PaO₂ ranges from 80 to 100 millimeters of mercury, when FiO₂ is 21%, of course. If we place an electrode into a blood sample, the dissolved oxygen applies pressure on it. That's the PaO₂ reading. In an ideal world, alveolar PaO2 and arterial PaO2 should be almost equal, but there's always a small gap between them called the AA gradient, or the alveolar arterial gradient. Under normal conditions, this difference is less than 15 millimeters of mercury. That's because oxygen must cross the alveolar membrane and capillary wall. Some loss is expected.
Imagine a patient with lung infection or inflammation.
Alveolar oxygen is normal, but the damaged barrier prevents oxygen from entering the blood properly. So, PaO2 drops and the AA gradient increases. A wide AA gradient equals possible gas exchange problem.
Let's test your understanding.
Which of these two people likely has a lung issue? Person A on a ventilator, PaO2 is 100, PaCO2 is 20, FiO₂ is 100%. Person B, a mountaineer on the top of Everest, PaO2 is 30, PaCO2 is 20. You have 20 seconds. Let's do the math. Alveolar PaO2 for person A. Alveolar PaO2 for person B. Now let's compare. In ventilated patient, alveolar PaO2 is 689 and arterial PaO2 is 100. So we have a huge gap here. But in mountaineer, alveolar PaO2 is 39 and arterial PaO2 is 30. It means we have a normal AA gradient. If you pick the mountaineer as a warning terrible, I'm a little worried. Seriously, do you think someone climbing Mount Everest is in a worse shape than a patient on a ventilator? SaO2, oxygen saturation. As we said, oxygen in the blood is either dissolved PaO2 or bound to hemoglobin. Hemoglobin has 4 chains, 2 alpha and 2 beta. Each chain contains an iron ion that can bind to one oxygen molecule. SaO2 refers to the percentage of hemoglobin molecules carrying oxygen. Normally, it's 95% or higher in healthy individuals.
Quick recap.
FiO2, fraction of oxygen in the air we breathe, normally 21%. PaO2, alveolar oxygen pressure, normally approximately 105 millimeters of mercury. PaO2, arterial oxygen pressure, normally 80 to 100 millimeters of mercury at a FiO2 21%. AA gradient, difference between alveolar PaO2 and arterial PaO2, normally less than 15 millimeters of mercury. SaO2, percent of hemoglobin bound with oxygen, normally greater than 94%. That's enough for today. We'll continue the story in the next episode. Until then, stay curious, stay up.
Interpreting an ABG often feels like a hitting but memorizing a salad of terms without understanding what the big one.